Thank you so much for joining us today. We are excited to have Dr. Andy Shih from Autism Speaks. He is the Senior Vice President of Public Health and Inclusion, and he is going to speak with us today. Andy, thank you so much for joining us.
Well, thank you, Laura. And it's a real pleasure to be here with you today. I want to thank Laura and, of course, Alpha Z Delta for this opportunity to share with you a little bit about what we do at the Public Health Department at Autism Speaks. My name is Andy Shih. I'm the Senior Vice President of Public Health Inclusion at Autism Speaks. I've been with the organization for a long time, since actually 2006, when the organization was first founded. I've played numerous roles. Autism Speaks over supporting our various scientific investments from genetics to clinical services and now to public health. I got my bachelor's in biochemistry from University of California, Berkeley, many moons ago, and then went on to get a PhD in molecular cell biology at NYU Medical School. I've done many postdocs, both industrial as well as academia, and have worked in many different areas of research. But I landed in Autism Speaks in the end, in Autism community in the end, because my cousin has a daughter on the spectrum. And when I first was introduced to the community, I was amazed by the parents, the families that are really not only doing their best for supporting their own family and children, but also trying to change the world so that the future of our children and family in our community can be different. So this is the reason I've stayed, and it's a real pleasure to be here with you today. I'd like to talk to you a little bit today about the work that we do in public health inclusion team at Autism Speaks, and first just tell you a little bit about why. And so this is a map of the world, and this country classified by income level by World Bank. And I just want to draw your attention to the orange country. These are the high income countries. So the Western European countries, Australia, South Korea, and so on and so forth, United States and Canada. So these countries where we live contain about 5% of the world population. What that means is that the rest of the world, 95% of the world population, including 95% of the families affected by autism, actually live in areas that are low and middle income countries. And the consequence of this is that in many of these countries, there is no services because there's no capacity, there's no expertise. Many of these countries, for example, in Sub-Saharan Africa, in South Asia, in Latin America, you have barely have a pediatrician, right, for thousands of children. Never mind a child development psychiatrist or child development pediatrician. So what we've also found is that the challenge that these families face in these low and middle income environment actually very similar to what we see here in the United States in some of the community, especially minority community where English is not the primary spoken language, as well as in rural community in the heartlands of America. They face similar challenges in terms of access. How do you get security services? The cost that's often associated with it, and of course, the quality of the service being provided is really making a difference for them. And we do know that things have only gotten worse with the pandemic, and that the inequity that was there previously have only deepened and widened as COVID hit various countries in the world, including America. So our work then is really focused on equity. In that word may have been you have heard in the community, especially in recent months. It's very different from what we call equality, right? And I want to make sure that I have an opportunity to clarify that. So equality is really what the top panel of this picture shows, is to give everybody the same thing, right? But what it doesn't take into consideration is what the individual may need and or ability to be able to utilize the resource or support that you provide. So equity is really to take that person's individual needs and abilities and capacity into consideration when you provide support. Only then will you be able to achieve a goal where everyone has an opportunity to realize his or her full potential. The way we do this is through a program initiative called the Gobots and Public Health Initiative, and this has been around for a while now. Autism Speaks, and we have invested in decades of AAC research and practice policy development globally. What we do is that we support local leaders to address local priorities using locally customized solutions. So, for example, we serve as technical advisor to governments and NGO partners, usually at ministerial levels. We started with 2 countries, Albania and Ireland, in 2009, and now I'm happy to share that we're in over 80 countries around the world. And what we do is that we help mobilize local leaders and resources for sustainable change. And our main partners in this program are many, but our main partner is a group of individuals we call the Advocacy Leadership Network. And the Advocacy Leadership Network is our engine for change, and it's a really global network of accomplished advocates. And these are individuals with a record of innovation and facilitating change in their home countries. They are self-advocates, they are caregivers, researchers, professionals, policymakers, friends, and families. And we continuously interact. This morning, for example, I was on Facebook Messenger with several of them. Through social media, we do this biannual conference and meeting to facilitate knowledge exchange and transfer, as well as collaboration. We have worked together effectively, facilitate some programs, including the CST, or the Caregiver Skill Training Program, which I will mention later on this presentation. We're now, as of, just slightly dated, but we're in over 55 countries now. And we have started to transition to regional groups to further sustain this global network. So what we do in general is that we put ourselves in the middle of an intersection between community, policymakers, and researchers. So our priority is to develop, implement, and evaluate community-based services with focus on health equity, as I mentioned earlier. Our strategy is the relevance and impact through multi-stakeholders, collaboration, and leveraging. We bring people together. We bring people from families, researchers, policymakers, politicians, to talk about and to come up with solutions together. And our product has been the data and tools to help mobilize knowledge, empower communities, enable better outcomes, individual, family, and community levels. So some examples that we create diagnostic tools for low resource settings. We develop interventions and inclusion programs, which I'll talk about later on, policy economic tools, and navigation tools, and so on. So now I'm going to give you a more specific example of the work that we do, and this is involves community engagement to enhance relevance, feasibility, sustainability of public health solutions. And this is a project we've been doing with the World Health Organization the past 4 or 5 years. It's the WHO Caregiver Skill Training Program, or the CST. So just a brief overview. The CST is a package, it's intervention, a community-based intervention that aim to empower caregivers and families with actionable knowledge, promote healthy development and outcomes. It's acceptable, meaning it's culturally competent in various settings, and especially scalable in low resource setting. So imagine a environment or a country or community where you have basically no medical specialists. The idea is that this program will be able to be established in that community to provide support. It's informed by evidence. Of course, we want to make sure that our community gets the best that science can offer. So we have evidence from high and middle income and low income countries, an ongoing evaluation process, a research process. It's designed to be adapted and integrated into existing services system of care, including health, education, social welfare. It's a modular package of group and individual home session designed to adapt it to the needs of different families. So it doesn't take a one-size-fits-all approach. It really trying to customize the intervention based on needs of the family. What it does is to leverage play and home routines, right? Things that everybody have. Enhance social communication, manage challenging behaviors, promote inclusion to family and community life. It can be ranged by, and this is really the most important thing, it can be delivered by a range of non-special providers, including teachers, nurses, social workers, community volunteers, caregiver, and parents. And this is obviously important because if you live in a community where there are no medical specialists, so there are no specialists when it comes to autism or the behavioral challenges, then you have to really leverage the capacity that you have in terms of others, such as teachers and social workers. And the package comes with an adaptation guide, facilitator guide, and participation booklets, and so on. And then we're targeting children caregiver of children 2 to 9 years of age with development delay and development disorder. Diagnosis is not required, even though it is strongly informed by autism intervention. The reason we don't make diagnosis requirements because you can imagine many of these countries and settings, even here in the United States, right? It's very difficult. It takes a long time. It takes resources to secure a accurate diagnosis. I want to make sure that financial issue, that barrier, is not a challenge for family to assess the needed support. So the age range can be slightly adapted, and the idea, of course, once integrated into the system, referral to the program can come from your primary health care provider, community health worker, and other specialists. And we expect, and we've seen these progress in families that have worked with us in the past 3-4 years, is that we see progress to a caregiver's goal for the child, improve child joint engagement, communication behaviors, improve caregiver well-being and family functioning. And we're seeing that there's reduction of stigma, because when the child is included into family life and it's part of what's happening in the community, there's less a stigma and a misunderstanding and greater acceptance of individuals and family in these communities. And this is where the core innovation of the program lies. And as I mentioned earlier, many of these communities we're trying to work in, there are no medical specialists. So there are no ABA specialists or a medical doctor per se. So what we do is that we, along with WHO experts, we go to a community, we train maybe some specialist psychologists at that are maybe in the capital or major metropolitan areas, and then they train facilitator or non-specialists, including nurses, teachers, social workers, community health workers, and peer caregivers, to actually deliver and work with the program to the families, right? So you see a cascade of training, but what it does is that it helps you move away from the limitation imposed by the need for specialists to deliver a professional intervention program. Now you can actually, by disseminating the knowledge within the community, you can actually enable greater access to an effective intervention. So where do we stand right now? As of earlier this year, there are 33 countries, active sites around the world that are actually piloting this program. We work with, like I said, we work with governments and so on. So, so the goal is to eventually make these programs at a scalable national level, become kind of default national service for many of these communities. And we've been funded by various agencies, including public health agencies and ministries and large NGOs. And we're near the end of our field testing of these packages in different communities, and we're aiming to publish it by the end of 2020, end of this year, Q4. And there is an e-learning version that we're developing right now. I'll tell you about in a minute. And another exciting development is that we have actually integrated this program now with some of the new UNICEF offerings, and so we're collaborating with UNICEF right now to pilot this program as part of a system of service in 3 countries: in Bulgaria, Peru, and Uganda. So stay tuned for more information about that. Of course, with COVID-19 this year, many researchers and experts and service providers are moving to online system, online platform. So we work with WHO to quickly adapt our CSD training material to e-learning version of the material. We intend this package to be used for in various settings, from self-paced learning to also be incorporated into more formal training that we offer once, hopefully when pandemic subside next year. But we are planning field testing 3 to 4 sites this year, and we'll make it publicly available by the end of this year as well. And finally, we've been hard at work to create some animation to further distill some of the strategy that are part of this program, so that the caregivers can be able to use it. And I'd like to share a 2-minute clip with you at this point, and I'll come back. Okay.
Hello. Parents and caregivers can help children with developmental disorders like autism by engaging with them in everyday activities. You may be wondering how it's done. Let's walk through it with Mary and her son Neil, who will show us in a few simple steps. Let's start by seeing what Neil is doing. Mary is removing distractions from the environment to make it easier for Neil to focus on her and create a shared activity. She clears away the toys on the floor and bed, but does not remove the blocks, since Neil is playing with them. Let's play blocks. Blocks. Very well done, Neil. Notice that Mary is imitating Neil stacking blocks. Neil is now noticing Mary and her actions. By imitating him, she is creating shared engagement, which means a child is paying attention to an adult and the activity they are doing together. This makes it easier for a child to learn. How do you set up your environment to make it easier to engage your child? That's right. Mary has shown us the steps to engage Neil in a shared activity are: 1. Notice what your child is interested in. 2. Remove distractions and make a safe place to interact. 3. Be in front of and at your child's eye level. 4. Praise your child, and when praising, be as specific as possible about what they are doing that is good. 5. Take your turn by imitating what your child is doing. As you practice this skill together, you can gradually build on it to help your child learn new things. Thank you. See you next time.
So that's the first video that we produced for this package. There's 5 more coming actually, and we'll be releasing them every 2 weeks before the end of the year. And we're hoping to get feedback. There's a survey attached to the video, hoping to get feedback from caregivers and potential users of this animation, so we can make them better as we move forward. And I hope it's clear through my presentation that individuals and families affected by autism should be at the heart of everything that we do, right? We work closely with them to develop solutions. We listen to them so we understand what the needs are. And of course, none of this would be possible without support from organizations like Alpha Z Delta. Your commitment to our community and to autism research has really enabled some of these amazing progress that you heard about in these webinars. And we want to thank you again for your support, so that all individuals and families with autism has an opportunity to have a better life, regardless where they live and who they are. Thank you very much.
No, Andy, thank you so much. We do have a few questions from our members, if you don't mind.
Of course.
Great, thank you. So we have someone asking, would you please be able to speak to the different kinds of autism?
Right. Thank you for that question. So we've known for a while now that the different subtypes of autism. So it's not a singular disorder or condition. Autism is autisms. And often, for example, the former Chief Science Officer of Autism Speaks, Jerry Dawson, have often talked about autism in the same way that people have talked about cancer. Not in the sense that autism is a life-threatening disorder the same way, or a disease like cancer, but the variety of causes that lead to the condition, and that the need for very different approaches to the condition is very similar to what we see in cancer. So what that means is that for autism, depends on the type, subtype you belong to, or the type of autism that you have, often associated with genetic liabilities. You may require a more targeted, more specialized support and services. And we've certainly seen this, playing out over and over again. For example, Fragile X kids and is a good example. Another good example is the Phelan-McDermott syndrome kids that we see in the community. These children typically they have some kind of a variation in their SHANK3 gene. Sometimes it's a mutation, sometimes truncation, duplication, so on and so forth. And an individual with a lesion in their SHANK3 genes, they have autism, but they also tend to also have hosts of other medical conditions. For example, cardiovascular issue is common with children affected by SHANK3 mutations. So understanding the subtype will allow us to better focus medical resources and to better focus more relevant medical resources for the individuals. We often heard that, when you meet one person with autism, you met one person with autism. So this is really a realization, right, of that understanding, is that when you can understand an individual's need better, you can provide better support and more targeted support. And that so that the relevance of the intervention and or the service that you provide and the impact that's resulting from them will be that much more enhanced.
That's great. Thank you. We have another question. There are some misconceptions about curing autism. Would you be able to speak to that in how that deals with the research and what you do at Autism Speaks?
Yes. Thank you for that very important question. I just want to be very clear, right? Autism Speaks, we're Autism Speaks. We're not out to cure autism. It doesn't make sense because, autism is not, we have moved away from medical model, from medicalizing autism, right? It's not a challenge there for health. We know that to have the best outcome possible for individual and family affected by autism, we really need that collaboration, coordination across health sector, education, social welfare, and social protection. So the central challenge for me, I think for us as a community, is really how do we provide accommodation support for individuals affected by autism, so that they can like everyone else, right, play to their strength, make additional accommodation for the challenges, and really to live to their fullest potential. So the idea that there's a cure for autism is really nonsensical. I think what we need to focus on is really how to better support this individual so they have the same opportunity like everyone else. We've seen over and over again that if we provide the right service, the right support at the right time, it can make a lifetime of difference.
And that's what we want to see. Thank you. Let's see, our next question, what advice would you have for our undergraduates who want to know more or get involved in a career in autism science or research?
Oh my God, thank you so much for the questions. As you know, it's such a daunting challenge, to our community, our country, the world. And the only reason we've been able to make the progress we've been able to make is because we have the support and the collaboration of many, many, many smart advocates, researchers, professionals, and policymakers. We need all the help we can get. And the next generation of advocates, policymakers, researchers are the ones going to make the difference. They're going to further change the world, further enhance the change we've already started, so that our families of the future will have a different world, a different tomorrow, a different reality to live in. So if you're interested in a career in autism, whether it's research or advocacy or anything else, please reach out to us. Reach out to me. You can happy to share my email and reach out to my colleagues. And we do have internships that are available for motivated individuals, and we welcome, embrace all support, all volunteer, all interest to make the life of our families better tomorrow than today. Thank you.
Awesome. Great. Thank you. Andy, there's a rumor that you are the longest standing employee at Autism Speaks. Is that true?
Yes, I am. I'm actually, I joined the organization via merger in 2006 between Autism Speak, that was just founded in 2005 by Bob and Suzanne Wright, and National Alliance for Autism Research. So I am the longest serving employee at Autism Speaks.
So then tell us, what are your most exciting changes you've seen? This is going to be twofold. One in research, and we'll follow up after this.
Yeah, you know what? That's an easy question, right? Because when I joined the autism research community, the autism community back in 2001, I don't think it's an exaggeration to say that we knew almost next to nothing about what caused autism, what's the best way to support our children, what are some of the other, medical challenges and community-based challenges that they have, and what are the possible solutions. We knew almost nothing. But here, I think in terms of the lifespan of research and medical science research, less than 2 decades later, we understand the genes that are involved. We understand some of the environmental factors that can lead to additional risk for autism. We know what to do to best support individuals affected by autism at early childhood, as they become young people, and now even more than ever as they transition to adulthood. So this amazing growth of knowledge about not only help us understand the needs of individuals and family, but to also better support them and accept them in the community. I think for me it's hard to pin out to any one particular advance in research, but it's really the explosion of understanding and knowledge of autism in the past couple of decades. I think that has made fundamental changes, not only to to the researcher and those who work in the community, but the lives of those who live with autism on a daily basis.
Wow. Yes, that is exciting. The follow-up question is, what is the most exciting international programs that you see budding or happening?
At the risk of sounding immodest, I would say the caregiver skill training program. Laura, I think what I always try to help people, remind people, is that things are difficult here in the States, right? For all families affected by autism, the challenges of trying to arrange services, trying to learn, trying to understand how to best support your child is daunting, and it's difficult for everybody. But as I mentioned in my presentation, today in this world, including families in the United States, where having services, having a opportunity for a better outcome is really more of an aspiration, right, than a possibility. And this program, Caregiver Skill Program, I think it provides a new bottom, a new floor, if you will, in terms of the level of support that our family are able to receive, regardless where they are, regardless how much money they have, regardless who they believe in, around the world. And that excitement is due to the fact that the realization that tomorrow we'll have more children and family with opportunity to live to their fullest potential than today. That to me is the ability to move that needle, to create a different tomorrow for our global community has been really the most exciting things for me. and then my colleagues at Autism Speaks.
Autism Speaks is making a difference. Thank you, Andy. Thank you for this presentation. We appreciate you, and ladies, we appreciate you taking the time to watch this recording. This concludes our presentation. I hope everyone has a great day. Thank you.
Thank you.